Today, we are jumping into the really high stakes world of veterinary medicine. We're going to look at the incredible science vets use to manage some super complex bleeding disorders in our pets and how they use their toolkit to make even the most dangerous surgeries safe. So let's get right to it with the one question that keeps vets and, honestly, pet owners up at night. Imagine your dog needs surgery. Could be anything, but they have a condition where their blood just won't clot. How in the world do you handle that? That's the huge challenge we're going to break down. So here's our roadmap. First, we'll get a handle on the problem itself. Then we'll dig into two very different solutions vets have up their sleeve. One that's all about borrowing clotting power, and another that gets the dog's own body to help out. We'll even investigate a fascinating little mystery about greyhound blood donors before we put it all together. All right, so what are we really up against here? Well, for a lot of dogs, the root of the problem is one specific inherited condition. It's called von Willebrand disease, or VWD for short. And it all comes down to a problem with a protein called, you guessed it, von Willebrand factor. You can think of this protein as the first responder at an injury. It's like the molecular glue that gets platelets to stick to a cut and start the whole clotting process. If you don't have enough of it, or if it doesn't work right, even a tiny nick can become a really big deal. And you might be thinking this is some super rare thing, right? Nope. It's actually pretty common in some of our most loved breeds, like Doberman Pinschers. And for these dogs, something as simple and routine as getting spayed or neutered suddenly becomes a high-wire act with a real risk of life-threatening bleeding. Okay, so you've got this problem. Vets need a way to give a dog's clotting system a massive, fast-acting boost. And the first tool they reach for is a really specialized blood product. It's called Cryoprecipitate, but everyone just calls it CRO. Think of it as a super concentrated espresso shot of clotting factors. It's not just plasma, it's the good stuff, refined down to be packed with the A team of proteins a dog with VWD is missing, especially that all-important von Willebrand factor. Now this is where the science gets really, really cool. How do they make this stuff? Well, they start with regular whole blood from a donor. They spin that down into fresh frozen plasma. But here's the brilliant part. They let that frozen plasma thaw out just a little bit. It turns out the heavy-duty clotting factors stay frozen longer than the rest of the liquid. So while it's in this slushy state, they spin it again, and all those protein-rich solids separate out. And that little bit of concentrate, that's the cryo. It's just genius. And this shows you exactly why they go through all that trouble. See, to get enough clotting factor from regular plasma, you'd have to give the dog a huge bag of fluid, which can be dangerous. But with cryo, you can deliver all that life-saving power in a much smaller, much safer volume. It is literally all about getting the maximum punch from the smallest package. But of course, this leads to another fascinating question. If you're trying to make this super concentrated product, does it really matter what breed of dog the blood came from to begin with? And this is a real head-scratcher for vet blood banks. Greyhounds are, in many ways, the perfect blood donors. They're calm, they have tons of red blood cells, they're often universal donors. But there's a catch. Studies show they just naturally have lower levels of von Willebrand factor and another key protein called fibrinogen. So what do? Does that mean you can't use their plasma to make CRYO? Let's actually look at the data. You don't have to be a scientist to see what's happening here. These charts compare cryo made from greyhounds to cryo made from other dogs. You can see there's some overlap, but for the most part, the clusters for the non-greyhounds are just shifted a little bit to the right, meaning they have higher concentrations, especially for fibrinogen. And this chart spells it out even more clearly. On average, a unit of cryo from a non-greyhound has about 332 milligrams of fibrinogen. The stuff from greyhounds? Only 221. That's a pretty big difference. So the question remains, is the greyhound product good enough? So what did the scientists decide? Well, the verdict is in. Even though the levels are lower, the cryo made from greyhounds is still potent enough to meet the same quality standards used for human medicine. It still works, and it's still incredibly valuable. So the answer is a big no. We don't need to exclude these amazing dogs from the donor pool. They can keep on saving lives. Okay, so that was solution one, borrowing power from a donor. But what if there was another way, a completely different strategy? What if you could just trick the dog's own body into releasing the factors it needs? Well, that's where this drug comes in. It's called Desmopressin, or DDAVP. And this stuff is fascinating. It contains 0 clotting factors. Instead, it works like a key. It goes to all the places in the body where von Willebrand factor is stored up, like in the blood vessels, and it unlocks the doors, causing a huge flood of the dog's own stored supply to rush out into the bloodstream. And the effect? It is absolutely dramatic. Just look at this graph. The flat line at the bottom is what happens normally. The lines shooting up, that's after a dose of DDAVP. You see this massive, immediate spike in clotting factor that peaks in as little as 30 minutes. It's like hitting a turbo boost button for the body's clotting system. So this sounds like a miracle drug, right? Problem solved? Well, not so fast. Like with so many things in medicine, there are some really important catches. And it all comes down to one simple fact. First off, dogs just aren't little furry humans. One of the big things researchers found is that dogs are simply less sensitive to this drug than people are. To get that same big clotting boost, a dog needs at least double the dose that a person would. And here's the other huge limitation. It's a phenomenon called tachyphylaxis, which is a fancy way of saying you can't just keep pushing the turbo button. That first dose works like a charm, but if you try to give another one 6 hours later, the effect is cut almost in half. The body just doesn't respond the same way. So why does that happen? Well, it goes right back to how the drug works. Remember, DDAVP doesn't make new factors, it just empties out the warehouses where they're stored. And once that first dose causes a huge release, well, the warehouse is empty. The body literally needs time to produce more and restock the shelves before another dose is going to do much good. Okay, let's bring this all home. We've got these two very different, very powerful tools. How does a modern veterinarian put all this knowledge together to make surgery safe? This table really sums it all up beautifully. You've got CRYO on one side. That's like calling in the cavalry, a direct, powerful infusion of exactly what the patient needs. But you need a donor. On the other side, you've got DDAVP. That's like giving a rousing speech to rally the troops you already have. It's fast and avoids a transfusion, but you can't count on it for a long, drawn-out fight. A great vet knows the pros and cons of both, and they'll pick the right tool, or sometimes both tools, for that specific dog at that specific moment. And really, that's what's so incredible about all this. The fact that we can now safely manage a condition like von Willebrand disease, something that used to be a potential death sentence, is just amazing. It really makes you wonder, doesn't it? What are the conditions that seem impossible to treat today that in the future will just be another routine day at the office for a vet?